Hi, my name is Brittney McQueen, and I'm going to be presenting on the effects of marijuana on athletic performance. We are going to start with a brief video on an introduction just to the topic about how marijuana is playing a role in athletics today.
Now, Yahoo Finance did this really interesting piece about how some people who are doing professional athletes, I should just say, admit to smoking marijuana, consuming marijuana, and a lot of them argue that it helps them in their sports careers because it lessens anxiety and it also allows them miraculously to focus on what they're doing, focus on their training, for instance. And it's fascinating stuff because, I mean, marijuana has a different impact on lots of different people. But in this case, some are arguing that it helps them. Now, one athlete says the following: marijuana relaxes me and allows me to go into a controlled meditational place. When I get high, I train smarter and focus on form.
Clifford Drzezinski. Not familiar with his work. But he's a triathlete. I don't know that. Every time we learn more about enhancing performance, it makes it harder to take a moralistic stance against performance-enhancing drugs. Baseball is still coming out of the shadows of a scandal that really damaged the sport dramatically, the steroid use. And no one's going to suggest that you can't hit while high. But if it helps you focus, it is a performance-enhancing drug. Where are we drawing that line?
That's a really good
something
point.
that makes you bigger and something that we know is dangerous, like steroids. I get why you could draw a line there because you don't want to encourage other people to do it to keep up with you because it's dangerous, so we can't. And so maybe that's the place where you draw the line. That's my most comfortable spot on steroids. But
And you bring up a really interesting issue within professional sports because there are some drugs out there that are completely legal, right? And people are prescribed these drugs because of certain conditions, and it does help them with their performance. So for instance, Adderall. I'm reading more and more about professional athletes abusing Adderall because it helps them with their performance. It does keep you more focused. It does give you some energy.
Yeah, baseball basically had an amphetamine problem since that exploded in the 1970s. For years and years and years, they're banned now too. And you don't think of it as the same kind of performance enhancing as steroids, but look, no one's gonna equate baseball players with minors, but for 6 months a year, 7 months counting spring training, you're playing every day, you're traveling every 3 days, you're getting on planes, you're getting places at 4 in the morning, you're in a different hotel room, and then you're playing an elite sport that requires intense concentration. And I'm sure it's hard to sleep, and I'm sure they're exhausted a ton. Day games and then some night games and mixed, and very few, 18 days off over 6 months. I imagine that popping a bunch of amphetamines was incredibly useful. Now you have to get there's a long process by which you have to prove that a doctor gave you this and that you need it for a condition other than the real condition that you want to take it for, which is I want to be awake and I want to be focused.
Right, exactly. Now going back to marijuana, some more testimony from people who have utilized this. This is actually from a researcher who's looked into it. We have cannabinoid receptors throughout our brains, and when the THC, which is a psychoactive ingredient in the marijuana, hits those receptors, it triggers a system that reduces anxiety. That you would feel more aggressive is a natural reaction to the drug. So
You feel more aggressive because it reduces your anxiety, although that flies in the face of the idea because most people on marijuana are not
aggressive.
Yeah.
But in this case, the researcher was responding to a professional skier who said, look, when I smoke marijuana, I'm actually a little more risky in my skiing. I don't have as much fear when I'm skiing as I do when I'm sober.
Yeah.
Marijuana has become a popular substance among many populations. In 2015, more than 11 million young adults used marijuana, and now marijuana is the most commonly used illicit drug in the United States. The main question with the athletic community is, should marijuana be considered a doping drug? Cannabinoids have been prohibited in competition since 2004, and because of increasing prevalence, marijuana use on athletic performance is an important topic in our community. So the big question I found while researching this topic is, what are the effects of marijuana on exercise performance, and should this be considered a doping drug? So we'll start with metabolic effects. In a study with 30 smokers, 12 females and 18 males, and 30 non-smokers, 12 females and also 18 males. Cannabis smokers had a higher percent abdominal visceral fat than non-smokers, 18 plus or minus 9% versus 12 plus or minus 5%. Also, cannabis smokers had lower plasma HDL cholesterol. However, fasting levels of glucose, insulin, total cholesterol, LDL cholesterol, triglycerides, or free fatty acids were not different between smokers and non-smokers. In the same study, systolic and diastolic blood pressures were significantly higher in cannabis users when compared with non-smokers. The study concluded that daily cannabis use can have differential tissue-specific effects on insulin sensitivity, but these effects appear to have minimal impact on glucose or lipid metabolism. Okay, moving on to lung function. In an article called The Effects of Marijuana Smoking on the Lung by Toshkin, acute effects showed that smoking a single marijuana joint, 2% THC, caused bronchodilation that persisted for at least 1 hour in healthy subjects and at least 2 hours in subjects with asthma. It also acutely reversed exercise-induced bronchospasm. In the same study, chronic effects of habitual smoking showed that smokers experienced persistent coughing, wheezing, and sputum production, increased episodes of acute bronchitis, exercise-induced shortness of breath was increased, and findings indicate that it was associated with significant airway inflammation and injury. Now, onto the effects of marijuana on athletic performance. In a study by Raynaud and Cormier, the research tested subjects 10 minutes after smoking a marijuana cigarette and noted a slight 16 minutes to 15 minutes, but significant decrease in cycle ergometer time to exhaustion. In a study by Toshkin, they reported deficits in reaction time, psychomotor performance, and standing steadiness. In a study by Avakian, the research showed in a double-blind study that THC or placebo did not affect blood pressure, ventilation, or oxygen uptake during submaximal exercise. It also showed an increased heart rate and the rate pressure product at rest during both exercise and recovery. In a study from 2011, research showed that cannabis decreases coordination, distorts spatial perception, and alters perception and awareness of the passage of time. However, they show that some positive effects of marijuana can cause vasodilation and bronchodilation, which can result in increased oxygenation to the tissues. Athletes report decreased pain during competition and increased focus. Decreased pain could be detrimental to an athlete who is exercising on an injury. Another effect of marijuana on athletic performance is the calming effect. Marijuana is shown to improve quality of sleep, which is in turn believed to be related to optimal exercise performance in competition. Marijuana may also reduce anxiety and stress on athletes pre-competition. Cannabis is shown to increase impulsivity, leading to more at-risk taking decisions. From a sports perspective, reduces anxiety and improves ability to perform under pressure. So, in conclusion, marijuana indirectly improves performance through lung function, has the potential to have positive effects on athletic performance. However, negative health risks should also play an important factor into the decision. Based on studies showing possible improvement in performance and negative health risks, marijuana should stay on the WADA banned substance list for in-competition sports until further research is conducted. More research is needed to determine the exact effects of marijuana on exercise performance and if this drug should be considered doping in athletics.